All right, so it's Andy here again. I'm in chapter 33, obstetrics and neonatal care, and I'm still on 1187 in your book. The next complication is just bleeding or an ectopic pregnancy. We touched on this in the gynecological emergencies chapter earlier in the book, but just to review, or if you didn't hear my lecture on that, I'm going to draw your attention to this picture right here. So in this picture, we're actually looking at, let me get a pen here. So we're looking at the fallopian tube here. This would be the ovary where the egg has been discharged into the fallopian tube, and then it's traveled down the tube. And in this picture, it says as a fertilized egg. So remember that once the menstrual cycle starts in a young female, that every month an egg gets deposited into the fallopian tube and then sent on to the uterus. And this alternates. So 1 month it comes out of one ovary, and then the next month it'll come out of the opposite ovary. Now, once sexual intercourse happens, if this happens while the egg is in the fallopian tube, which is where fertilization should take place, is inside the fallopian tube. If that happens and there is some type of damage to the fallopian tube, then it could cause an ectopic pregnancy. So it comes down here at the bottom of the column here, and it says a history of pelvic inflammatory disease, tubal ligation, or previous ectopic pregnancies should heighten your suspicion for a possible ectopic pregnancy. So every month before the female had intercourse, this egg was able to sneak past that scar tissue in the fallopian tube. But this particular month, when she had intercourse, while the egg was in the fallopian tube, their egg was fertilized, and now that egg immediately begins to grow, and now it can't get past that scar tissue, okay? So the egg develops right there in the fallopian tube, causing ectopic pregnancy. This is a true emergency. The female could hemorrhage. You need to call for ALS backup. Make sure you treat for shock. You're likely to have vaginal bleeding as well. So that is one of the complications, ectopic pregnancy, okay? All right, so I'm gonna stop this video and I'm gonna move on to the next complication.